Next up, we have Dr. Erskine. Is Diana coming? Oh, there's Diana. Okay, great. Utilizing simulation to identify and meeting learning needs among nurses.
Hello, good afternoon, everyone. My name is Alison Erskine, and my colleague here, Diana Potakey, we will be talking to you about utilizing simulation to identify and meet learning needs among our nurses here at University Hospital at Downstate. So the Institute of Continuous Learning, ICL, team, we have always been looking to revolutionize the way we bring education to our staff. So thanks to our past director of nursing, Dr. Karen Brooms, who is no longer here with us, who was so innovative. And so we looked at our last training when we had to do our re-in-service and our skills fair. Okay, so coming out of that skills fair, we thought of using a different approach. And this approach we used was a simulation approach. So here the research says that simulation is imitating or representing an actor system. And that's by the Society for Simulation in Healthcare. It also says that simulation allows novice nurses to gain new skills and increase their confidence related to patient care. It also allows expert nurses to hone already established skills and for them to grow. So the Department of Nursing Education, we play a central role in assessing our nursing needs, their learning styles, and planning and implementing education offerings. So this simulated method we used, and so the nurses came to skills fair. We had a total of 203 nurses that came to skills fair. And so the scenarios, they were read and they were asked to demonstrate and verbalize what they would do with the patient. So our validating educators, they observed the staff and they utilized a checklist of expected actions, interventions to identify missed opportunities and also to identify the knowledge gaps. So the nursing staff, they received real-time reinforcement of expected interventions and remediation for the missteps as needed. So these were the areas that were chosen. The areas were strategically chosen, and we chose 7 areas, including patient identification, code management, hypoglycemia, blood product transfusion and transfusion reaction. We also did physical restraints and acute ischemic stroke. All right, and management of the suicide patients. Okay, so I'll hand you over to Diana to continue.
Okay, so in these topics that Dr. Erskine talked about, if, for example, if you talk about code management, the case scenario, it was included with actions and expected interventions. For example, if a nurse is in a code, for us to check for competency of the nurse, having a knowledge of how to manage a patient during a code. What are your expectations? What do we want to see as a nurse? So first of all, we want to make sure that we gave them a case scenario and want to make sure that they are able to follow the algorithm of American Heart Association. The first thing is scene safety. Were they able to do that? If they were able to do that, we give them a point on the checklist. Then we find out if they were able to look for, checking for responsiveness. And if there was responsiveness, what did you do? We want to see the next step. Were you able to call for help? Do you know the number to call for help in hospital? Because we are in the hospital, so we expect them to demonstrate and show us that they will be able to call 23 for help to come in. And then after you call for help, what will be your next step as a nurse? So all these actions we're looking for. If the nurse was able to meet these actions and expected intervention, we give them that competency for that. But if they fail to meet that expectation, we remediate them after the scene safety, after the case scenario and everything is done. In analyzing the results after these case scenarios and the topics that we went through, we identified that 89.6% of our staff really know what they are doing, and they didn't need remediation. About 10% of our staff had to be remediated. And the areas that we remediated mostly in our results in the change was to see in blood transfusion reaction, and then also when it comes to physical restraints. Those areas we remediated a lot of nurses. And in that situation, because we did it in a real time, we're able to close the gap. Our goal or our objective of utilizing simulation to identify and learning needs among our nurses was to educate our nurses to meet identifying knowledge gaps and in delivering safe patient care. So in that real time, we're able to close the gap so that they will be able to retain the knowledge without having a lot of material to take along and go and put it somewhere. But in that moment, they will be able to remember so that when they go back to the clinical practice, they will be able to remember, hey, I made a mistake here, so now I know what my intervention is. So from that result, our transforming part, we were able to find out that there was the need for future study in this, because during that process, it increases our nurses' confidence and then their critical thinking ability in that moment. But we thought of it that for future implication, for future study, more evidence-based practice research might be needed in assessing the effectiveness of this confidence for our nurses in utilizing our patient case scenarios in those situations in providing care. Even though in that moment their confidence was increased, how do we know the effectiveness of their confidence? So that was another need for us to do a research in that to see the nurses' confidence in providing quality patient safety care for our patient. I guess that's the end of our project.
Thank you.
Any questions?
Everyone's getting tired. You got to get some coffee. We got questions. All right, excellent job. Thank you, Diana and Dr. Erskine. Thank you so much. Great job.